Hi guys, welcome back to March and Will's channel again. I know it's been a while, but I'm back. It's been 5 years and then some of wearing my dental bridge. Hi, my name is March Smith and welcome to our channel. I know it's been almost 6 years that I've been wearing my bridge, and it's another time to talk about how well am I doing with my bridge. Am I going to do it again? If will I do it all over again? In this video, we will talk about the pros and cons, the good, the bad, and the ugly, and how am I doing after 5 long years of wearing my dental bridge. So we asked ChatGPT on what we should talk about regarding dental implants, dental bridge, and dentures. And here is some of the pointers that ChatGPT gave us, and let's talk about it. So one of the reasons why we are going to tackle this topic. I know it's very sensitive, very less informed, let's just say, because there's a lot of people are kind of embarrassed about their teeth, their smile, and their confidence. That's why we wanted to talk about it right now. So most of you, I don't know if have you seen this video or if you've been following my compilation. So let me just kind of give a summary of what happened to me when I was 13, not 13 years ago. What am I talking about? So about when I was 13 years old, I got my four front tooth pulled, no cavities, nothing wrong with them except for they are crooked. So they're not like cavities or tartar or something like I had an accident, but I just had to have it pulled because of the fact that I have crooked teeth. And in the Philippines, where we can't afford orthodontics, or at that time, we can't afford to have braces. So they had it pulled, and my parents or my mom decided to just have them pulled and get me a denture. So I started wearing dentures since I was 13 years old, and that was very difficult growing up. And I turned 20 before I came to the US. We decided to have a dental bridge because that is the only way to have a fixed dental structures that's unremovable and cleanable and more natural look than having dentures. I cannot afford dental implants, nor it's possible to have dental implants in my case, so we decided to have dental bridge. And I'll put the link on the description below. What happened then in all the compilation videos that I've done, that was almost 6 years ago. And now we're here after 5 long, almost 6 years of wearing dental bridge. What is it like? Should I change it, or will I do it all over again? So the first thing that ChatGPT said is talk about dental bridge. So what is dental bridge? It's literally a bridge. It's a bridge between the gap left by a missing tooth using neighboring teeth for support. And the pros on having a dental bridge: less expensive than implants, faster procedures, looks natural, usually completed in a few weeks, and no surgery required. I would say no surgery required because you don't have to have your teeth pulled unless it's needed. All they have to do is have 2 or more abutments or teeth that are healthy and, of course, are available to create that bridge between the gap or the missing teeth. Cons, of course: healthy adjacent teeth must be filed down. When you have those foundation that needs to be used, they will grind the teeth or file down to have that, so they can put those foundation on, just like crowns. You can't have like a thicker layer of teeth. They have to be filed down to be used as abutment, and they need to be replaced after 5 to 15 years. So my bridge is almost to that point where I wanted to change it, and we'll talk about that later. And another cons is it doesn't prevent the jaw bone loss. I don't know if that's the case for other people, but I hope that will not happen to me. But it does not prevent losing your jawbone for having a dental bridge. The last cons is more difficult to clean underneath. I understand why they said that that's a con, because of course it's not your natural teeth anymore. You have to find a technique on how to clean it, how to care for it in order to have a long-lasting dental bridge. and I will put the link on the description below on how I clean my dental bridge according to what I have. So other people might have a different dental bridge, but this is the technique on how to clean my dental bridge since I have it. So those are the pros and cons of having a dental bridge. If you guys have a dental bridge and any techniques that you can share to us on how to clean it, if you recommend a dentist that you guys like, please do comment below and where they at. Some people would like to have a dental bridge or consultation near you. It would definitely be helpful if you guys post that. So let's talk about dentures. What are dentures? They are removable prosthetic teeth used to replace multiple missing teeth or a full arch. So the pros of dentures: it's more affordable than dental bridge, replaces many teeth at once, replaces non-surgical, and faster treatment. Unfortunately, a lot of people are wearing dentures because they think that that's the only way of having a good smile, or that's all they can afford. I don't recommend that, but this is the least thing that I would recommend for people that have missing teeth. Because, of course, these are the cons. It can slip or be ejected out of your mouth while eating or talking. Requires adhesives, of course, to avoid that slipping or being removed for some users. May affect taste and speech initially. Can contribute bone loss over time, and that's what happened to my bone. Wearing dentures, having my teeth pulled since I was 13, I don't have any more bones left on my front mouth. It's gone. And periodic adjustments as needed. As we grow older, that's why they put that on the con side. As we grow older, our gums reside or recede. It shrinks as well. So wearing dentures for that long period of time requires adjustments or even replacement. And I know it's cheaper, but it is very uncomfortable of not having your teeth while you're getting your dentures done. Imagine that, guys. So this is the least thing that I would recommend for you, having a nice smile. If you can invest or afford it, go for dental bridge or dental implants. Let's talk about the dental implants. This is the last one that we're going to talk about because of the cost, and it can have some cons as well. So what is dental implant? A dental implant is a titanium post surgically placed into the jawbone that acts like a natural tooth root. It will act like your bone in your teeth, or gum, sorry, the gum. It will be surgically inserted in your gum line. And the pros of having dental implants: it has the most natural looking option. That's why it's expensive. Can last decades or even a lifetime. That's why it's a good investment if you guys wanted to have dental implants. Helps preserve jawbone, since your teeth or your tooth will be directly inserted. Sorry, the titanium screw will be directly inserted into your gum line. That creates that protection from your jawbone and helps to keep or maintain that, compared to having dental bridge or dental or dentures, right? It doesn't affect neighboring teeth, which they don't have to file it down having a dental implants. Only that particular tooth that needs to be screwed in or put crowns in is going to be affected. And you have a strong chewing ability, since it's directly using your bone structure. You will have more strong chewing ability. Now, the cons of dental implants: its most expensive option, requires surgery. Healing may take several months, and not everyone has enough bone density, and that's what happened to me. Why we cannot do dental implants anymore, because of the bone density. There's no longer bone. There's no more bone that can hold those teeth in front, right? So it's best for single tooth replacement, long-term investment, and patience with healthy gums and bone structures. Those are the three things that we wanted to emphasize and talk about more on this video. If you are looking for a better smile, are looking for that new self-confidence and self-esteem, what will be the most cost-effective for you? What would you like the best, right? I preferably like dental implants. Unfortunately, in my case, I have to wear a dental bridge. Number one, because I cannot afford a dental implants. Number two, my bone or the bone density or bone structure is no longer there to be available for a dental implant. And number four, that's the most affordable. Did I say that already? After 5.5 years of wearing my dental bridge, what will I do different? So after wearing my dental bridge for almost 6 years, what will I do different? I wish I have a bigger teeth. I wish that I told my dentist, hey, I know you're concerned about my, the cleaning or cleanability of my dental bridge, but I like to have a bigger teeth if possible. Since I'm paying a lot of money already, I should have insisted of how I like my teeth to be. Because, it's not bad looking. I probably know about the crack also that happened in the front teeth. But I still wanted, if I just smile like this, I want my front upper tooth or teeth will show instead of smiling all the way up, up here. I just want just a complete smile, or just a simple smile like this, and you will see my upper teeth. But right now you can't. If I smile like that, I wish that I made it bigger or made them bigger. Number two is when I have my bridge installed almost 6 years ago, it's hard for me to speak, the S, to pronounce some words. It's hard for me to bite. I don't know where my bite was back when this was installed. We kind of grinded some of my teeth just so all of my upper and lower teeth will meet when I bite. And I just didn't think about that. I want my bridge or my upper bridge to meet my lower bridge in order, properly enough for me to talk. I have to practice constantly how to pronounce words, S words, R words. That's really important, you guys. If you are deciding to have a dental bridge, implants, or dentures, make sure that you can speak clearly. Practice, especially if you guys have the temporary teeth or tooth installed, make sure you practice your speech. And that's one thing, the ugly of not having that in my mind. I didn't even think about it. And another thing is I should have researched more on what type of materials they should use on my bridge, my dental bridge. Let's talk about the materials to use. You should use of having an artificial tooth or dental structure. And of course, we asked ChatGPT again. And when replacing missing teeth, most people focus on cost, but not the material used for your artificial tooth. And it can affect how it looks, feels, lasts, and even how much maintenance it requires. So we're breaking it down on the most common materials used in dental implants, bridges, crowns, and dentures. Porcelain. Number one is porcelain or ceramic. Porcelain is one of the most popular materials because it closely resembles natural tooth enamel. But there's a pros and cons of using porcelain. So the pros, of course, it looks very natural in appearance, stain resistant, excellent for front tooth or teeth, and it's metal free. However, the cons is can chip under heavy pressure, and I think that's one of the reason why my front tooth, because it's mixed with zirconia and porcelain, that's why it chipped right away after biting into a fork, guys. And usually more expensive and not always ideal for teeth grinding. And I grind my teeth every single night. Guys, we also have to talk about that later on, or maybe in a different video. So make sure you ask me questions or tell me what topic you guys wanted to talk about the next video. And what's best for, again, it's your front tooth because it looks natural, cosmetic smile makeovers, people wanting the most natural look. And you can see, I think mine is mixed with zirconia, and or it's not, I think, I was told that I have zirconia and porcelain, so it looks natural and also sturdy, or will last long for having zirconia. So the next topic, speaking of, is zirconia. Has become increasingly popular because it combines strength and aesthetics. And what's the pros of having zirconia in your dental bridge, dental implant, or dentures? It's extremely durable, natural in appearance, metal-free, biocompatible, so you don't get allergic reaction to that materials, and excellent for implants and crowns. So since it's very durable and strong, it really is good for having for implants and crowns. Porcelain, not so much, because it's mostly used in dentures, right? Now the cons: more expensive than some alternatives, can be difficult to adjust after placement, of course, because since it's durable, it looks like you have to replace a whole thing before you get a new zirconia put in again, you know, since being durable. And what's best for, of course, for back teeth like your molars, implant, crowns, long-term durability, and many dentists consider this as one of the best all-around materials available today. So those are the two things that we already talked about, porcelain and zirconia. Now, zirconia, help me guys, help me. Another material that is popping up and it's getting popular, it's called porcelain fused to metal. Some people I know, I think my sister have dentures that has porcelain and metal. This option combines a metal base with a porcelain outer layer, because the pros are they're strong, they're a long track record, usually less expensive than the zirconia. And the cons, of course, metal line may show near the gum. So I think I used to have metal, or I've seen people that has dentures that uses metal hooks or metal all around, like near the gum, and it just doesn't look good. It just looks dark and unnatural. And metal, oh, by the way, metal can be allergic to some people. Like I am allergic to metal. I didn't know when I used to have metal filling. I didn't know that it causes you headaches or pain for having a metal filling. So thank goodness I didn't have that much pain, and it was recognized right away that I'm allergic to metal. So we took that out immediately and put the white filling in my teeth or tooth. And porcelain can chip, of course, because it's mixed with porcelain and metal, and less natural appearance over time. So that's what we already talked about. And what they use this for is for bridges, back teeth. Back teeth, I understand, since you can't really see it. Budget conscious patients. For durability and cost effective, people use this material. And then we do have the acrylic resin dentures. Most traditional dentures are made from acrylic resin. They're affordable, lightweight, easy to repair. That's why they're mostly used for dentures. And of course the cons: less durability or less durable, more prone to staining, may wear down faster. And what's best for is for traditional dentures, temporary dentures, budget-friendly solution. And we do have, wow, there's a lot of materials that we can choose from. Another material that you can choose from is that flexible nylon denture. So I don't know, I've never heard that before, but I guess there are flexible nylon dentures that are for partial dentures, and I think I've seen it on video before, for, you know, that looks like a natural gum line. And it's lightweight, less likely to break, but it's harder to adjust, not ideal for all patients. And last but not the least, the titanium dental implants. Actual implant post placed into the jawbone is most commonly made of titanium. Yeah, so if you guys wanted dental implants, titanium dental implants is what they recommend for you to have an extremely strong dental implant. It integrates with your bone, proven success rate, long lasting. The cons, of course, require surgery, small risk of metal sensitivity, just like I was talking to you about earlier. metal. That's why you have to test. Make sure you're not allergic to metal. Make sure you let your dentist know, hey, I might be allergic to metal. I don't think this will work for me. You have to speak up. It's your own body, right? And the most popular implants, most implant patients, they use titanium for their teeth. And then they have the zirconia implants as well. I didn't know that there's one more. Zirconia implants. Pros, white colored material, metal free, biocompatible. So again, if the titanium dental implants will not work for you since you're sensitive to metal, then the zirconia implant will work best for you. Of course, it's higher cost and less long-term research compared to having titanium. So if you guys have any other question, I know we've talked about this, we've commented about this, and it's been almost 6 years. What do you think? Did you guys have dental implants, dental bridge? Please share your experiences or will have an experiences. I know for sure, I know for the fact that the next time I'm going to have my dental bridge is I'm going to the Philippines, where I came from, because of it's really cost effective. Yes, I have to fly over there and pay for the ticket, but the cost, the materials, and it's advanced there already, so I don't have to worry about that. And I know I've already asked some of the dentist offices there and how much it will cost. Roughly, I think the one that I asked is 22,000 pesos per tooth. But when you calculate that in dollar, if I have 8 to 10 abutments, I will only spend almost $4,000 for 10 tooth. So imagine that. I spend almost $10,000 for 8 teeth here in the US, and I'm only going to spend almost $4,000 to go over there, to have a vacation, to have all the relaxing amenities in a dentist office and the islands of the Philippines, and a vacation. I'll probably spend almost the same, but I know for sure that I'm gonna not regret it. And bottom line is I wanted to be happy. So so let's talk about the bottom line. Of course, you want the best appearance for your look. If you want a bigger teeth, I have to smile. I want my teeth to show, my front teeth to show right away, because I know we corrected my bite, and you can see I have looks like an uneven face right now. Another bottom line is best combination of strength and beauty, just like what I was talking to you about. Most proven implant material and most affordable denture material if you guys wanted to have a denture and metal-free option. So those are the things you have to consider before you decide which one is best for you. So the best appearance, again, they said porcelain. Best combination of strength and durability, they said is zirconia. Most proven implant material is titanium. Most affordable denture material, acrylic resin, and the metal-free option is zirconia. So I'm glad that I am able to share to you again after 6 years of wearing my dental bridge. Please send me your comments and questions. Share your experiences in the comment below, and I'll be happy to answer them. I'll be happy to make another video for all of you guys, and hopefully answer some of the questions that you might have. Again, thank you so much for watching this video. I will put several links below, my compilations of and some of the materials that you should use, dentists, and so on and so forth. You will see all the links in the description below. Again, thank you so much for watching. My name is March Smith. This channel is March and Will Smith. We do all kinds of videos about our success, failures, our adventures, travels, and fun. I'll see you guys again in the next one. Make sure you subscribe to our channel. You can see us on Instagram. I almost forgot. Make sure you subscribe to our channel. You can see us on Instagram, Facebook, Pinterest, and TikTok. I'll see you guys again in our next video. Bye.